Good morning, Kern County, and welcome to another episode of Kern Living. I'm your host, Ryan Nelson, and today we're here to talk about men's health with our friends from Omni Family Health, but I'm gonna let them introduce themselves.
Hi, I'm Dr. Munnainathan. I'm one of the family physicians and associate medical directors at Omni Family Health.
Now we're talking about men's health. How often do men actually come in for checkups?
General, statistically speaking, women do come for appointments more than men, but I've seen a trend where more 20-year-olds, 30-year-olds, 40-year-olds are coming in asking, hey, I just want to make sure I'm healthy. I hear about all these things in the news. I just want to make sure that I'm good to live a long and happy life.
Gotcha. And for men, what age and what type of checkups should men be getting?
So men should start screening at an age that they feel is important for them. I would recommend just getting an yearly checkup from your doctor. We check blood pressure every single time the patient comes into the office. We check their weight as well. And then, between the ages of 35 to 45, we'll start checking their diabetes, if they have diabetes, if they have high cholesterol. But of course, if they've had other risk factors for these, we will start earlier. Other tests include screening for HIV, screening for hepatitis C and other STDs. That can start at a really young age too. Usually after around the age of 16, I would recommend. And then getting a colon cancer screening, either through a colonoscopy or getting a test done at home or in the office is another good screening test. The biggest question that most men have is, what age should I start getting a prostate exam done? And that should be a conversation with your doctor. There are certain factors that are involved with that decision, and it's something that they should talk to their doctor about.
Wow, that's a lot of good information, especially I didn't even know some of this stuff, so it's good to hear. But what would you tell a man that doesn't feel like, I don't have to go in, I'm fine, I feel good, I don't need a checkup? What would you tell them?
Yeah, so I usually use the example of, maintaining your car. Every so often you want to, change the oil, you want to rotate the wheels, you want to check the brake pads and all that. So you do that, and why do you do that? You do that because you don't want the car to break down in the middle of the road, but you also do that because you're going to be driving people that are depending on you to make sure you maintain your car, and they're depending on you being in the car with you. So when it comes to health, it's also the same thing. You don't want your health to deteriorate all of a sudden in the middle of nowhere. And also, there are people depending on you. There are people that need you to be healthy and happy for a very long time. So it's important to maintain yourself as well.
I love that analogy, the one of a car, because for the men who play pickup basketball, soccer, football, and your knees hurt a little bit more than usual after you play, it's okay to get a checkup. And I'm glad that you gave us all these facts and reasons why it's important. So thank you, thank you, thank you. Thank you for your time, and also thank you for watching. Make sure you follow us on all social media platforms at Kern Living and myself at Ryan Nelson 23, and I will see you next time.